What defines an addiction?
The whole process of addiction, I believe, has three parts to it. The beginning part is a want, a desire, using a substance or behavior to cover up maybe some emotional pain or anxiety and depression that we're feeling. And it's used more recreationally. I think when it becomes more in the addictive, the middle phase is when we need it more than want it. And we'll really do anything to do that behavior or to get a hold of that substance to stay more and more numb to the original pain. And I think the end is hopefully sobriety, which involves usually long-term rehab, detoxification, sober living homes, and I think psychotherapy plays a part in all three. Often people will come in and ask me, am I addicted? And so we recognize, is what you're doing interfering with the quality of your life or not? And if so, is there room for modification? Or do you go cold turkey? And I think with certain like self-harming behaviors, there's no modification. You go, or moderation, you go cold turkey. Alcohol, it's a whole different ballgame. And then with the addictive part, a psychotherapist can come in and say, you're losing your life, you're losing career, you're losing your mate, you're not spending time with your children and loved ones. We've got an issue. And really straight talking with the patient. And then the third process is helping a patient either through the process of detox and rehab. Often I'll go and visit patients in rehab hospitals and work with them and the hospital staff together. To sober living homes, to sobriety, and then for long-term sobriety maintenance.
What types of addictions do people have?
The most common addictions I see is alcohol and drugs, self-harm, gambling, and addictions towards eating disorders, and exercise. And those are the main things that I see. But an addiction is defined by anything that you need to do on a more than recreational basis that is causing harm in your life.
Are there any healthy addictions, or there's no such thing?
That's a really good question. I think there are healthy dependencies. I don't know if any addiction, the word itself carries a problematic sense. There's a problem with what you're doing.
Do you help people get over the hurdle of addictions?
I help mostly in the first two phases, which is recognizing it and then straight talking with the person about them needing help. I think in a serious addictive process, 24-hour care is what really seems to make the difference. Addiction has a high recidivity rate, so people come back and use and use. Even people that hit rock bottom can stay sober for a few years and come back to the substance or behavior. It's very, very tricky. I don't think anybody has the answer. But I find people have the most success with long-term 24-hour care and then coming out and using psychotherapy for long-term maintenance.